If you're a parent, you've probably had at least one moment like, oh no, is this normal about your child's teeth? We've all been there, and it means you're a great parent because you care. So, today I kind of want to walk through the most important things you want to know about your child's teeth in hopes it takes a little more stress off your plate. Hey, Verse TV, my name is Kelly. I'm a registered dental hygienist, and I'm a proud Verse ambassador. Did you like that? And I work in pediatrics. I'm a pediatric dental hygienist for 5 years now. I'm a little bit of a kid myself, but what can I say? You kind of have to be when you work in peds. Plus, I have 3 kiddos of my own. And even being in the dental field, I've had those moments where it's like, oh, is this okay? Is this normal? Because my parent mode just kind of kicks in, and then my dental mode, boop, and we're all human. So, again, it's okay if you've had these moments before. Let's talk about why baby teeth matter. What is the purpose of baby teeth? Aren't they just practice teeth? Doesn't really matter because you lose them anyways. They matter a lot, and let me tell you why. They help kids chew so they get proper nourishment. It helps them speak properly. When you talk, notice how much your tongue actually ricochets off the backsides of your teeth when you talk. And if there's missing teeth there, you're going to start mispronouncing or not being able to enunciate words correctly. And that can cause a kid to be super self-conscious. I see it all the time. Kids just don't want to talk because they notice their lisp or the way they talk because their front 2 teeth or a lot of their teeth are missing. Baby teeth help your kid to smile, makes their lips sit in a natural position. Believe it or not, just simply smiling boosts a kiddo's self-confidence and helps them play and join in other things regularly, like recess and games in the classroom. Very big reason why they are very important. They hold space for the adult teeth to come through in the right position. If baby teeth fall out too early or if they're wiggled out too early, it can cause crowding and shifting when the permanent teeth come in. So yes, they are very, very important even though they're temporary. You may notice that baby teeth and permanent teeth look different. I have parents ask me all the time, why are my kiddos' teeth so small or spaced out, or why are they yellow? This is the thing. Baby teeth are supposed to look different than permanent teeth. Baby teeth are smaller, they are wider too, and they have thinner enamel. And if you notice your child has spacing in between their baby teeth and they don't touch, that's actually a good thing. It's very helpful. We love to see space in between teeth. This is very helpful when you're cleaning your kiddos' teeth. It's way easier to clean when they have spaces, especially in between teeth where flossing surface cavities tend to happen a lot. But if there's nice spaces, it's least likely to have a cavity in between baby teeth. And it gives adult teeth room to come in later. If you see adult teeth coming in behind baby teeth, you might also call this shark teeth. My daughter actually has this right now. It's usually harmless and it'll sort itself out once that baby tooth is gone. But of course, ask your dentist if you're concerned. How do you take care of those little guys? Brush 2 times a day for a full 2 minutes. If your child is 3 and under, you're going to use just a smear of fluoride toothpaste or a rice size if you want to have something to compare it to. Once they're 3 and above, you want to use a pea-sized amount of toothpaste. So yes, adults like us should use a pea-sized amount. That's it. That's all you need. Floss every single day. Floss the teeth, especially before nighttime. Nighttime is the most important time to floss teeth. Going to bed with clean teeth. I just cannot say that more. Clean teeth before bed is huge because at nighttime the mouth tends to get drier and that's what cavities love. Try to avoid sugary snacks and drinks, especially before bedtime. No bueno at bedtime. We just want really great snacks like cheese, meat sticks, or anything like that before bedtime. And then brushing and flossing is the absolute last thing we want to do before we go to bed. After your child is done having a snack and you notice that it's still on the tops of their teeth, right there, you're going to want to either offer water just to kind of help rinse the food out from the grooves of their teeth. You could brush their teeth too if you have access to a toothbrush, but if you don't, you always can swish with water. If you have a cheese stick in your bag, oh, I love cheese sticks because they actually clean the grooves in the top of the teeth, or an apple. If your child is under the age of 6, and I would say I'll probably even be brushing my kids' teeth even above the age of 6, make sure you're supervising and then going in after them, especially at nighttime, to make sure you see all of the plaque, all of the food is out from on top and in between teeth. Especially flossing, cannot stress that enough. Most kiddos do not have the dexterity to floss properly, especially the far back molars. My kids are 6, 4, and 3, and I still floss and brush their teeth every single night just because I know it's hard for them to do it themselves. Did you notice that this is very similar to taking care of your own adult teeth? Yes, very similar. Monkey see, monkey do. Getting into these habits early really sets them up for success their whole entire life because they have to go to the dentist their whole entire life. Very common question: when should I bring my child in to see the dentist? Textbook answer: when their first tooth appears. Or if you don't really see any area concern and you are really good about brushing your kiddo's teeth at nighttime every single night, really good about going to bed with clean teeth, then you could usually say by their first birthday. But before then, if your child has trauma to their teeth, they fall over, they hit their tooth, there's blood, there's splitting of the teeth, of course you want to seek a dentist right away. Or if you notice pain, sensitivity, or a dark area, dark spot on their tooth. I see lots of families come in just so we can look, dental professionals looking in their child's mouth, because we might know something that you might not know. And it's just great peace of mind to have a professional in your child's mouth making sure that everything is nice and healthy. The sooner your child goes to a dentist too, they get used to a dental environment, again, setting them up for success. And yes, we do believe in treating cavities in baby teeth. Even though they are going to fall out, untreated decay can cause pain, infection that starts a brewing and it doesn't get taken care of. It can affect the permanent teeth underneath the surface. Parenting comes with a lot of worries. I want to take baby teeth panic off that list. Your child's baby teeth have a big job, but with great habits and regular checkups, they're in great hands. If you have any questions or you have specific topics that you want us to cover, comment down below. We love helping families feel confident about their oral health. Thanks for watching. Keep smiling, little and big.